Hi, I'm Dr. Molly with Your Goals Physical Therapy. Let's talk about stopping that muscle spasm that happens between your shoulder blades. So the other day I got a frantic phone call and it was from somebody who rolled over in bed, right? Super common, rolled over in bed and was woken up instantly because something happened and all of a sudden she had a huge muscle spasm that caused basically was attacking a nerve and it was sending radiating pain up into her head. So every time she couldn't find a comfortable position. She was stuck. She was basically waking up every couple of hours because she had giant shooting pain from her shoulder blade up to her head. She just couldn't find a comfortable position. Head couldn't be up too much, couldn't lay on her side. It was just miserable. She took ibuprofen, she tried heat, she tried sitting, up in a chair. She tried everything that she could, and she was just miserable all night. So when she calls me, she wants to know how to make this better. And she was like throwing out ideas and anything that she could do today, right now, to help her. And so thought it would be good to make a video and kind of talk about that. Like, what do you do when you wake up with searing pain that is preventing you from being able to move your head or your shoulder throughout your day without just dramatic, sharp pain? So I'm going to give you the same tips I gave her, and then I'm going to talk about how to get rid of that and have it not come back. Because for some people, that reality is something that happens every 2 or 3 months. And so let's talk about how just to make that stop, because it is possible to make that muscle spasm in your back, that tight tension that everybody holds in their shoulder. It is completely possible to make that go away forever and just not be a problem. So first, my suggestion for my friend here was that she, instead of using the heat pack, to try to find a nice comfortable position. So if you, as comfortable as you can get, right? So if that means that you can lay in a recliner with your head back a little bit and just resting against the back of the recliner, or if you can lay completely flat, which would be more ideal, then that's what you do for 10 minutes with an ice pack right where the problem is. So that way you're in the most relaxed position you can possibly be in, and you're gonna put ice on there. Just hang out for 10 minutes. When the ice is done, what you wanna try to do is just gently move your head. And I mean that. So all you do, keeping your head either against the recliner, whatever you can tolerate, or if you can lay flat on the floor, your head stays on that surface. And you just rotate right to left, nice and slow, whatever the range of motion your body will let you have. So you don't want to make it painful in both directions. You just go whatever it will tolerate. Set yourself a timer, go for about a minute, and then you switch. After that minute, you do yeses. So you look up and then down like you're saying yes, but you don't lift your head. So whatever that range of motion is, because some people, they have a lot, and some people, they don't have too much, and one direction can be painful. So you just do what you can. After about a minute, if that helps, which it should, then try another round before you try to sit back up or get up from the chair, and see if that's at least dulled the discomfort. The idea behind these is trying to find something that's going to calm down the muscle spasm. Because the muscle spasm between your shoulder blades is what's causing that severe pain. And as much as heat packs sound like the idea, a lot of times with this, there's already a lot of inflammation involved, and so the hot pack just makes that inflammation a little bit worse, and then it can increase your pain level. So that is what I suggested, and it helped my friend. So hopefully it will help you as well. Now, how do you prevent this from 1, happening, and then 2, reoccurring every couple of months? Well, you need to find the root cause. And unfortunately, because it is your shoulder blade, that means that your shoulder could be involved or your neck. And it's really hard to tell without having somebody look at you and see how you're moving and see what your posture looks like, to see, is it something that's shifting in your neck that's causing the muscle spasm? Is it something that's shifting? It could even be, it's very unusual, but it could even be one of your thoracic spine, like one of the bones in your thoracic spine. So, the area of your rib cage, that could be shifting a little bit and making that muscle spasm, because your body doesn't like anything to move in your spine. You can't have your spine move. It's very dangerous. So, but there, the other thing is, and this is kind of forgotten about, is that your shoulder flexibility and stability plays a big role in what happens in your back. So if you have a shoulder that doesn't move too well, then your upper back might be trying to help compensate. So again, this is very complicated. This is not a one solution for 10 people. There's normally a lot of different variables that are happening for each individual person, which is why when people try to do general exercise programs or just general like exercise correction protocols, it can, maybe it gets you some of the way there, but there's still something that's residuals, because everybody's so different. How you live your life is different. How you sit is a little different. Your job setup is different. Home life is different. So all these things are different. So really, to get rid of the problem that we're talking about, you need a very specialized plan for you, because you're the only person that lives exactly your life and has exactly your body. So that is the type of service that I help with people, or I provide people. So I help people come up with very specific protocols or exercises that will help correct that. And the nice thing is, once you know how to do these things, you don't have to see me again if it ever happens again, which hopefully, right, the idea is that we get rid of it and it resolves. But we all know that after you get done with your exercise program, you don't have any pain, people tend to slack off a little bit. It's just human nature, right? If it doesn't hurt, why are you going to keep treating it? But when you work with somebody and you learn how to fix it yourself, you don't have to call somebody again, right? You already have the tools in your house to fix the problem. So there you go. So those are the types of things that I help people with, and I hope that this information is very helpful. Have a great day.